everybody, it's Dr. Magnifico from Vet and Probably.com. This is Benjamin Winston. He is a rather older guy. He's got concurrent multiple diseases. So he's got Cushing's disease and diabetes on top of being an older guy. So a lot of things going on with him. He's blind because of his diabetes. So that's certainly another thing that he's got to deal with on a day-to-day basis. One of the things that happened to him is he started to get a mass on the side of his body. So here's where my incision is. He had a mass on the sides of his body. It was almost as big as my fist. So we'll show you a picture of the mass. What was particularly concerning is because he's got so many things going on and because he's an older dog, his owners, rightly so, were very worried about putting him under anesthesia. And really, as in most cases, we're always trying to weigh the benefits of surgery and the risks of surgery against the risk of keeping, a mass or a growth or something. His mass got to the point where it was starting to ulcerate, meaning it was dying on the inside. The skin had stretched so much that it was breaking open and it was leaking. So it was becoming chronically painful for him. He was uncomfortable lying on it, and then because he's lying on it, because it became so big, it started to rupture and open. So now we've got a chronic source of a wound, and it's never going to heal because it's abnormal tissue, and then we have to worry about flies and parasites getting in there on top of him licking, and a lot of dogs will self-traumatize to the point where they sort of start eating their own mass, one because it's leaking fluid and that never stops. So it got to the point where we really felt like if we didn't remove this mass from him, it was going to impact his quality of life. Certainly surgery, which is always an anesthetic risk, was something that we were very, very worried about. So we took a couple of extra precautions. We did a full blood work. We did a very thorough exam. We put him on IV fluids. We gave him very safe, quick-acting anesthetics, and then we had a lot of very close monitoring. Actually, for his surgery, I had another veterinarian come in and help with the anesthesia so that I could get him on the table and off the table as quickly as possible. We also prepared his site long before he went under anesthesia so that we minimized our surgical time. So through a team effort, which was me talking to their parents and going over all the things that I was worried about and all the things that they were worried about, making sure that he was current on all the stuff that he needed, meaning his medications this morning, his insulin. We've been very closely monitoring his blood glucose. He did really well through surgery, and he is finally going to get rid of this mass, which has been troubling him for quite a long time. One of the questions that I get a lot is, my dog's too old for surgery. Well, I sort of beg to differ. If you've got a dog who's struggling with something, either a non-healing wound or a mass that's getting really large and cumbersome, then talk to your vet about taking it off. I would rather die trying than not try at all. And he was one of those cases where we just sort of had to take a leap of faith. We had to utilize all of our skills, and we had to do the best we could to give him back his quality of life. So it's one of the things that I never want to discourage people. Your dog is never too old to do surgery. They're never too debilitated. You can't live in fear. Certainly bad scenarios can happen, but not doing anything because you're crippled in fear is just one of those things that is not acceptable to me. So he did great. He's going to go home and hang out with his parents soon, and we're going to hope that this is the last, surgery that we have to ever do on him. But certainly he's got some really good days ahead, and he wouldn't have had them if he had that mass. I would say the cost for his surgery is probably, $300 to $400. We try very hard to be very reasonable here. We did do some pre-op stuff, which was blood work. X-rays are another thing to talk to your veterinarian about. So you will definitely spend a couple $100 in pre-op stuff, but getting him back to being comfortable, getting him so he can move around, getting him so he's not laying on this thing, and then getting a mass off, which was chronically uncomfortable and bleeding, is really what's important. So he did great. We're very happy to have this done and behind us. I know a lot of people worried for a long time, but he's moving on. Dogs live in the now, and they do really well, and they are incredibly resilient. So don't give up on them, because they won't give up on themselves. If you have any questions about his case, about older dogs and mass removals, about how much things cost, you can find me anytime here at Vet in Maryland, or you can find me on Probably.com, or check out my other YouTube. Take care, everyone. Say bye. Say bye.